Hey everyone, BreeAnn Allred, physical therapist and pelvic floor specialist. I want to talk to you a little bit about pregnancy and exercise and what's safe. I know there's videos on here from a gynecologist perspective, but let's talk about it from a physical therapist perspective. When we're looking at the body during pregnancy, there are tons of changes. So I tell women typically that anything that you're doing before pregnancy is safe for the most part to continue throughout pregnancy, but you may need to modify it just a little bit. One thing I don't recommend during pregnancy is any form of crunches. Reason for this is that it activates the rectus abdominis muscles, which are a pair and located on either side of the body. And this overactivity of these muscles or continually exercising these muscles as they're being stretched can promote further diastasis recti issues. Now, we will talk in further videos about diastasis recti. So, first recommendation is to avoid any crunches. I personally really enjoy any exercises that do activate kind of lower abdominal muscles slightly, and anything that really works with our transverse abdominis. Now, when we're talking about the transverse abdominis, this muscle is a muscle that attaches to the back muscles and then goes all the way around the body and attaches to the back muscles on the other side. It also attaches down at the pubic bone area and then up along the rib cage and along the areas of the pelvis and rib cage there. So it's a large muscle. It gets stretched to Timbuktu and back when we're pregnant, and it is very, very hard for this muscle to activate. Now, we want to get this muscle active and we want to keep it active. Doing so can actually help provide good support for your pelvis and for your back during pregnancy, and it helps this muscle maintain its activity as much as we can in a stretched position to be able to have ideal recovery and to prevent a lot of pain and issues during pregnancy. So to activate the transverse abdominis, I want you to imagine that you're looking at the lower abdominal muscles, and I want you to pull those lower abdominal muscles towards your spine, almost like you're sucking in, but the motion is happening below the belly button. When you're pregnant, it's really easy to see this muscle activate because you're going to see these muscles pull back towards your spine. You're going to feel that pull your belly and your baby back towards your spine. Another descriptor that I'll often use when you're pregnant is that you're giving your baby a hug with your abdominals. So thinking, okay, we're gathering them together, pulling them back towards the body, and you should feel that movement happen. Now, when you're exercising the transverse abdominis, I want you to hold this contraction for 10 seconds and repeat it 10 times. This can be done all at once or throughout the day. I also encourage you to do it with activity and to use it as your body's natural back brace. So any activity that you're using that kind of puts some tension or pressure on your back, any kind of lifting, any kind of bending over, you should pre-brace with these abdominal muscles to provide support in those time frames.